Hello everybody. Today our topic is a disease affecting 1/3 of the world population and is responsible for 9 million new cases and 3 million deaths worldwide. Our topic today is tuberculosis. Tuberculosis is an infectious endemic disease produced by Mycobacterium tuberculosis. It involves granuloma production, inflammation and destruction. Tuberculosis can be pulmonary and rarely can be extrapulmonary. The course of tuberculosis is a chronic and often fatal course. What is the difference between latent tuberculosis infection, active tuberculosis, and when do we say a patient has a TB case or is a TB case? Latent tuberculosis infection is a latent infection with Mycobacterium tuberculosis with no clinical, radiological or bacteriological signs of disease, while active tuberculosis disease is an infection with Mycobacterium tuberculosis with clinical and or laboratory including radiological manifestations of disease and is determined by multiplication of Mycobacterium tuberculosis and the host response. Furthermore, when we say that a patient is a TB case, we mean that this patient has active tuberculosis, either bacteriologically confirmed or diagnosed by a physician, and in which anti-tuberculosis treatment initiation is decided. Let's speak about the epidemiology of tuberculosis. The epidemiology is that 1/3 of the world population is infected with Mycobacterium tuberculosis, which is about 2 billion people, and 9 million new cases every year. 3 million deaths attributable to TB every year. What about the etiology of tuberculosis? Etiology of tuberculosis, we can start with Mycobacterium tuberculosis complex, which is made up of M. tuberculosis, Mycobacterium bovis, which is rare and involves the intestinal transmission, M. africanum, which is rare Central and Western Africa. Other mycobacteria which is included in the etiology of the tuberculosis include pathogen M. leprae, leprosy, other conditional pathogens such as M. scrofulaceum and saprophyte. Let's speak about the Mycobacterium tuberculosis features. 1. They are resistant to staining and destaining, acid-fast bacilli. 2. They are attributable to slow growth, which is generation time of 18 to 24 hours, 3 weeks on solid culture media. 3. They are mandatory aerobic. 4. They are intracellular parasites. And 5. They are destroyed by ultraviolet radiation. Infectiousness of a source depends on concentration of Mycobacterium tuberculosis in sputum. We say S positive, and S positive is more infectious than S negative, and cough frequency. Let's speak about the tuberculosis transmission. A patient with pulmonary TB can cough, sneeze, talk, small drops comes out of his mouth, droplets, nuclei travel to the non-infected host and he becomes infected. Severity of infection depend on contact duration and proximity with the source, virulence of Mycobacterium tuberculosis strains. 3. The individual resistance to this infection. How can you decrease the risk of infection? 1. Early treatment. Find the case and early treated and corrected through ventilation and exposure to ultraviolet light, which can be natural or artificial. 3. Improvement of housing and nutrition. Risk factors for TB. 1. Recent TB infection less than 1 year. Recent TB infection from 1 to 7 years. HIV infection. IV drug abuse plus HIV. IV drug abuse with no HIV. Silicosis. Chest X-ray abnormalities, renal failure, diabetes mellitus, underweight and absence of risk factors. How can you decrease the risk of disease in infected individuals? 1. You treat the patients with latent TB infection through chemoprophylaxis, and 2. You give BCG vaccination. The evolution of this tuberculosis infection. 1. Progressive reduction of Mycobacterium tuberculosis population can be complete elimination or persistent to a dormant bacilli stage. 2. Resorption of inflammatory foci, sometimes preceded by caseous necrosis. 3. Fibrosis and sometimes calcification of the multiplication foci. What is the mechanism for the TB disease? 1. Continuous evolution after the primary infection, and this case is rare. 2. Endogenous reactivation, in which the Mycobacterium tuberculosis multiplies starting from the dormant bacilli. This reactivation is dominant in low-incident countries. Furthermore, exogenous reinfection, which means a new infection in a person previously infected followed by disease development. And this reinfection is dominant in high-incidence countries. The diagnostic methods for finding out the person has TB or not. 1. You identify M. tuberculosis. 2. Histopathologic examination. 3. Tuberculin skin test and IGRA test. First, we will speak about identification of Mycobacterium tuberculosis. This can be done by optical microscopy, which has sensitivity of 10,000 bacilli per milliliter. 2. Mycobacterial culture and species identification, and is the reference method, and sensitivity is 100.